Let's do the hand washing first. And I'm wearing PPE kit. Hello.
Hi.
My name is Gurveda Kaur and I am a student of coronary care nursing. And my student ID is 10445725. I'm here to perform a health assessment and health history assessment. May I know your name, please?
My name is Arpan.
And what's the reason you have been there?
Crushing pain in the chest,
Okay. What's the chief complaints?
chest pain.
Okay. And now I'm going to perform a QQ-RST assessment to assess the pain level. So may I know you what make it worse or what make it better?
Nothing make it worse, nothing make it better. It's just because of shoveling snow through my driveway.
Okay. And what does it feel like?
It feels like a crushing pain in my chest.
Okay. And may I know reason of the pain and is it radiating to somewhere?
It's mainly in my chest region, and yes, it radiates to the left arm as well.
Okay. So to assess the severity, there's a scale. You have to rate 0 to 10. 0 means there is no pain and 10 means there is an extreme pain. So how will you rate your pain?
I would rate it as 8 out of 10.
Okay, 8. And when it starts?
It usually starts in the morning. I
Okay.
never had this pain before.
Okay. And what do you think it means?
I think I'm having a heart attack.
Okay, you wonder it is a heart attack. Okay. So do you have any difficulty in breathing?
Yes, no.
Okay. And do you feel any trouble breathing while you are lying down?
No.
Okay. And do you have do you have cough or?
No.
Okay. So have you had fatigue or any activity intolerance?
No, I don't think so.
Okay. So do you think you are you are a pillar?
I don't think so that I'm a pain.
Okay. So to check the cyanosis, let me see your eyes, please. So there is not any cyanosis. Can I see your hands, please? There is not any cyanosis. So do you have any edema, any swelling?
No.
Okay. So how often you urinate at night?
I don't urinate at the night so often.
Okay. So do you have any past cardiac history?
Yes, I'm suffering from the condition hyperlipidemia since last 5 years.
So do you have any family history of?
My father suffering from the myocardial infarction at the age of the 56 years, and my parental family history is hyperlipidemia and high cholesterol level.
So may I ask you about personal habits, like do you drink or smoke?
I don't smoke, but I drink red wine every week.
Okay. So do you have any leg pain or cramps?
No leg pain, no cramps,
Okay. Do you feel any skin changes?
no skin changes.
So have you take any medication to relieve your hyperlipidemia?
I'm taking vitamin D and azetrol for hyperlipidemia.
Okay. So have you been any allergy?
I'm allergic to bees.
Okay. So I'm done with the health history. So now I'm going to perform the chest examination of the client, and for that I need to inspect the chest of the client anteriorly or posteriorly. At the anterior side of the client there is not any lesions or abrasions, and at the posterior side spine is symmetrical and there is not any barrel chest or any other abnormal findings of the clients of the chest in the client. And now I am going to perform your chest assessment. For that I need a stethoscope. So I am going to assess your heart sounds, and for that I need to palpate the sternal notch. And right side of the sternal notch there is an aortic valve, and here we can listen S1 and S2 sound, and S2 sound is greater here than S1. And then at the left side of the sternal notch there is a pulmonic valve, and same as the aortic valve there is an S2 is greater than S1. Little downward than there's a tricuspid valve. S1 is greater here than S2, and little downward from this there is an mitral valve, and there we can assess your apical pulse, and we can assess it for 1 minute to check the rate and rhythm. So in this patient there is an reading that your rate is 72 per minute, and your rhythms are normal. Now I am going to assess the heart murmurs of the client. So for that, same as the heart sounds, we palpate the sternal notch, and at the right side of the sternal notch there is an aortic valve. There is not any heart murmurs. And at the left side of the sternal notch there is an pulmonic valve. There is no murmur, same as the tricuspid valve. And at the apical pulse at the mitral valve, there is not any heart murmurs. So in this client all the readings are normal. So I am done with all the chest examination, with all of the procedure of the chest examination. So thank you for your cooperation, and I will document all the findings to the physician. Thank you.
Thank you.